Every year, millions of seniors go in for routine checkups, thinking they're doing the right thing. But what if I told you some of these very tests might actually raise your risk of stroke overnight? It sounds hard to believe, doesn't it? You trust your doctor, you follow every recommendation, but buried in the fine print of modern medicine are silent risks that no one warns you about. Not the news, not the brochures in your clinic, and sometimes not even your doctor. Imagine walking out of your annual checkup thinking everything is fine, only to experience dizziness, blurred vision, or worse, just days later. And you're left wondering, what just happened? Here's the reality. Some diagnostic procedures, particularly when performed too frequently or when you have specific health conditions, can quietly cause sudden increases in blood pressure, interrupt healthy blood flow, and even start a chain of events that could result in a stroke. But please understand, this video isn't meant to frighten you. Its purpose is to empower you with knowledge so you can ask more informed questions, helping you to safeguard yourself and your family. Because after you reach 60, it's not just about finding health issues early. It's equally about preventing problems that might be unintentionally created by the very tests meant to help. In the next few minutes, we'll reveal 5 common medical tests that could have hidden stroke risks, particularly for older adults. And most importantly, you will learn specific steps you can take to protect yourself before your next medical appointment. If you are over 60, please type a 1 in the comments below. If you are not, type a 0. And be sure to subscribe to the Dr. Morrison Senior Health Tips Word Key, where we bring you the information others might not share. Now, let's begin with the first test you may want to reconsider. Let's discuss the CT scan with contrast. If you've ever had one, you might recall a warm, flushing sensation spreading through your body. That's the contrast dye at work, helping your doctor get a clearer view of your blood vessels, organs, and tissues. It sounds very useful, right? But here's something many seniors are not told. That injection can do more than just improve the image quality. It can quietly place strain on your heart and blood vessels, particularly if you are over 60 and managing conditions like high blood pressure, heart disease, or reduced kidney function. For some individuals, the contrast dye can cause a vasovagal reaction, which is a sudden drop in heart rate and blood pressure. This may lead to feelings of dizziness, nausea, fainting, or even a brief loss of consciousness. However, in other cases, the opposite occurs. Blood pressure can rise sharply, causing fragile blood vessels to constrict or go into spasm. When this happens, the potential for a stroke or heart-related event quietly increases. Research published in the Journal of Vascular and Interventional Radiology indicated that older adults who had contrast-enhanced CT scans showed a notably higher rate of vascular complications within 72 hours, particularly those with a history of high blood pressure, heart disease, or kidney impairment. In simple terms, the more vulnerable your cardiovascular system is, the greater the potential risk from that contrast dye. Consider a real-life example. An 81-year-old man had a routine abdominal CT scan after experiencing minor stomach discomfort. The scan results were normal, and he was sent home feeling well. But 2 days later, he suffered a minor stroke. The suspected cause was that the contrast injection may have temporarily spiked his blood pressure, leading to a clot that blocked blood flow to a part of his brain. This does not mean CT scans with contrast are inherently bad. Not at all. They are critical for detecting serious conditions like cancers, blood clots, and aneurysms, discoveries that can save lives. The crucial point is this: these scans should be used judiciously, not just ordered routinely as a precautionary measure without clear need. So, how can you protect yourself? Before agreeing to a CT scan with contrast, ask your doctor, is this scan absolutely necessary, or is there a safer alternative for someone of my age and health status? Be sure to share your complete medical history, especially if you have high blood pressure, kidney issues, heart conditions, or have had previous reactions to contrast dye or medications. Always inquire, can this be done without contrast? In many cases, a non-contrast CT or an ultrasound might provide sufficient information without the additional risk. Next, we'll talk about a common screening many seniors undergo, even when they feel perfectly fine, one that may not be as harmless as it seems. Now let's turn to the stress test, often called an exercise stress test. On the surface, it seems like a prudent step. You're connected to a heart monitor, you walk on a treadmill, and your heart's performance under physical stress is evaluated. But if you're over 60, especially with high blood pressure or known heart conditions, this seemingly simple test can carry risks. Here's why. During the test, you are asked to walk and then jog on a treadmill while your heart is monitored. As the intensity increases, your heart rate accelerates, your blood pressure rises, and your entire cardiovascular system is placed under significant strain. For a healthy young person, this might be manageable, but for seniors, particularly those with pre-existing conditions, it can be like striking a match near kindling, potentially triggering serious complications. Some risks include dangerous surges in blood pressure, sudden irregular heartbeats, arrhythmias, and in rare but serious instances, small tears in fragile blood vessels, including those in the brain. A 2020 study in the American Journal of Cardiology that followed over 300 patients aged 65 and older who underwent treadmill stress tests found that nearly 7% experienced adverse events during the test, including sharp blood pressure increases and abnormal heart rhythms. The group most affected were those who already had vascular problems. This isn't just a statistic, it happens in real life. One of our subscribers, Margaret from Ohio, shared her experience. She is 74 and has managed high blood pressure for years. Her doctor suggested a stress test as a routine check. Halfway through the treadmill portion, she felt dizzy and had chest tightness. The test was stopped immediately, but by the next day, she had suffered a minor stroke. Her doctors believe a sudden spike in her blood pressure during the test may have ruptured a small vessel in her brain. To be clear, the test itself did not directly cause the stroke, but it placed immense stress on an already vulnerable system, which may have been the tipping point. So what is the key takeaway? Have a conversation with your doctor. Ask, is there a safer way to assess my heart health? Often a nuclear stress test, which uses medication to simulate the effects of exercise, or a resting echocardiogram, may be safer options for older adults. And if you aren't currently experiencing symptoms like chest pain, shortness of breath, or unusual fatigue, ask if the test is truly necessary at this time, or if it can be postponed. Coming up next, we'll examine another routine test that appears harmless but could have hidden risks if you are not careful. Let's now discuss a procedure that has become very common, especially after age 60, the endoscopy. Whether it's to examine your esophagus, stomach, or colon, doctors often recommend it as a precautionary measure, and sometimes that is the right course of action. But here's what isn't always communicated. If you don't genuinely need it, and particularly if it involves sedation, it could potentially cause more harm than good. First, most people over 60 take daily medications. Blood thinners like warfarin, aspirin, or clopidogrel are extremely common. When you are sedated for an endoscopy, your blood pressure and circulation naturally fluctuate. Combine that with medications that affect your blood's ability to clot, and you face a higher risk of internal bleeding, or more seriously, issues with blood circulation to the brain that can precipitate a silent stroke. A large-scale review published in 2021 in the journal Gastrointestinal Endoscopy found that among patients over 65 who underwent endoscopy procedures with sedation, there was a notable increase in transient ischemic attacks, TIAs, often called mini-strokes, within the following 72 hours. These were not major strokes, but they served as warning signs that blood flow to the brain had been disrupted. One case that resonated with me involved a 76-year-old woman who had a routine colonoscopy with sedation. She had no symptoms beforehand, but 2 days later she began slurring her speech and lost coordination. The emergency room confirmed she had experienced a mild stroke. Her doctors theorized that the drop in blood pressure during sedation, combined with her daily aspirin regimen, may have created the perfect conditions for a clot to form or travel. This doesn't mean you should refuse all endoscopies. It does mean you should not agree to one unless your doctor can clearly articulate why it is needed now. If you are having it done simply because a certain number of years have passed, ask if there is a safer way to monitor your health, especially if you have no symptoms. Always remind your doctor of all medications you are taking. Ask them, will I need to stop my blood thinner before this procedure? What are the risks of sedation for someone with my health profile? If you are uneasy about sedation, ask if the procedure can be performed without it or with milder sedative options. Next, we are going to talk about another test that often goes unnoticed, but involves an organ we don't always think about, the kidneys. MRI scans are powerful tools. They allow doctors to see deep inside the body, identify early signs of disease, and sometimes avoid surgeries. However, when a contrast dye is used to get sharper images, that's when extra caution is needed, particularly for older adults, and especially for those with even mild kidney impairment. The contrast dye used in MRIs often contains gadolinium, a heavy metal. It is not meant to stay in the body. It should be filtered out by your kidneys. But here's the issue. After age 60, kidney function naturally declines. If you have chronic kidney disease or reduced function that hasn't yet been diagnosed, your body may not eliminate the gadolinium effectively. Over time, small amounts can remain. This retention can be problematic. Gadolinium retention has been associated with a rare but serious condition called nephrogenic systemic fibrosis, NSF, which causes thickening and hardening of the skin and connective tissues. In severe cases, it can limit movement, affect breathing, and lead to organ complications. But there's another aspect most people don't hear about. Retained gadolinium has also been found in brain tissue. Some researchers believe it may contribute to subtle neurological symptoms like confusion, dizziness, and disorientation, particularly in individuals already at risk for circulatory issues. A 2019 study published in Radiology followed over 2,000 patients aged 65 and older who received contrast-enhanced MRIs. Within a week of the procedure, about 5% reported stroke-like symptoms: headaches, blurred vision, balance problems. These were not full strokes, but they were concerning signs. Most of these patients also had underlying kidney issues, whether they were aware of them or not. Consider Harold, a 79-year-old veteran from Arizona. He had an MRI for persistent back pain. His doctor ordered it with contrast for a more detailed look. Harold was unaware his kidney function was weakened. 2 days after the scan, he felt lightheaded, weak, and mentally foggy, symptoms that lasted almost a week. It was only after his primary doctor ran blood tests that they discovered he had stage 3 kidney disease. "No one warned me," he told us. "If I had known, I would have asked more questions." So what can you do? If your doctor recommends an MRI with contrast, ask, is it possible to do this without the contrast? Frequently the answer is yes. If contrast is truly necessary, request a kidney function test first. This is a simple blood test called a GFR that can provide important information for you and your doctor. Also inform them if you've ever had any unusual reactions to imaging dyes in the past. Remember, the MRI itself is not the problem. It's the additional chemical that your body might not process well. With the right precautions, you can still get the necessary answers without putting your brain or kidneys at risk. Next, let's focus on a test that seems harmless, even wise to do regularly, but it might lead older adults towards surgeries they don't actually need. The routine carotid artery ultrasound. It's non-invasive, takes only a few minutes, and involves no needles, dyes, or loud machines. It sounds like the ideal preventive test, doesn't it? But here, as what many people over 60 aren't aware of, if you have no symptoms and your doctor is ordering this scan just as a check, this simple test could lead you down a path toward an unnecessary surgical procedure. The carotid arteries are the major blood vessels that supply blood to your brain. Over time, like many vessels, they can develop plaque, build-ups of cholesterol and calcium. This is a normal part of aging for many people. However, not every plaque deposit needs to be removed. In fact, in numerous cases, it is safer to monitor it than to intervene surgically. This is where things can take a wrong turn. Suppose you have the test and it reveals some narrowing in the artery, perhaps 50% or 60%. That sounds alarming, right? So your doctor refers you to a vascular surgeon, and suddenly you are being advised to consider a procedure like a carotid endarterectomy or a stent. But if you had no symptoms, no dizziness, no vision changes, no weakness, these procedures may offer very little benefit while carrying real risks. A major study published in the New England Journal of Medicine followed over 3,000 seniors who had moderate carotid artery narrowing but no symptoms. The researchers found that for many, surgery did not significantly reduce the risk of stroke any more than medication and lifestyle changes alone. More concerningly, a small percentage of patients who had the surgery actually experienced strokes as a direct complication of the procedure, either during the operation or in recovery. A story that illustrates this comes from Helen, an 82-year-old from Pennsylvania. She went for a checkup, feeling perfectly fine, and had a carotid ultrasound simply because her doctor wanted to be thorough. It showed 65% narrowing. She was scheduled for surgery within weeks. Tragically, during the procedure, she suffered a small stroke. She survived, but now lives with weakness on one side of her body. She told us, "I wish I had known that in my case, watchful waiting might have been the safer option. So, what should you do? If your doctor suggests a carotid ultrasound and you have no symptoms, ask, what exactly are we looking for, and what will we do if we find something? Ensure you understand whether the scan will change your treatment plan or simply cause anxiety. If you are already on medications for blood pressure and cholesterol and are living a healthy lifestyle, additional testing may not change your care. If you've already had a scan that showed narrowing, don't panic. Ask about monitoring with repeat scans instead of immediately opting for surgery. And always seek a second opinion before agreeing to any vascular procedure. Let us conclude with some heartfelt advice and a gentle reminder that you are the most important advocate for your own health. Here is the essential message. Not every test is dangerous, but not every test is necessary, especially after age 60. Our bodies respond differently. What seems routine, like an injection of contrast dye, a sedative, or a screening scan, can have unintended consequences that we don't always anticipate. A simple injection might raise your blood pressure. A scan might trigger an adverse reaction. Even a quick checkup can pose risks if your body is vulnerable. That's why it is so vital to pause, ask questions, and ensure that every test is truly appropriate for your specific health situation, not just part of a standard protocol. You have every right to speak up, to ask, is this absolutely essential? And to say, can we discuss a safer alternative? Because informed decisions lead to better health outcomes and greater peace of mind. Your health journey is unique. Your voice matters. Here at Tadiu Dr. Morrison, Senior Health Tips, we believe every healthcare decision should be guided by knowledge and thoughtful discussion, not by fear or routine. If you have ever felt unwell after a medical test or have seen a loved one go through an unexpected health event after a procedure, please type a 1 in the comments. If not, type a 0. Let's share our experiences, support one another and learn together. And if this video has helped you feel more aware, more in control, or simply more curious about your health, please subscribe to our channel. We are here to uncover the facts, ask the difficult questions, and always prioritize your well-being.